Hi, my name is Sonia Liebendorfer, and I've created this video for heart failure patients and their family members and those that love them so they can really get an idea about what heart failure is and how it is so important to understand why you need to take better care of yourself. This is an introductory video that will pretty much go over the causes of heart failure, and it also contains an action plan of what you need to do to make sure that you ensure that you have the best care possible. Also, I am going to be following this up with a video explaining the different types of heart failure and the treatments for those. So you can indulge yourself with as much or as little information as you would like to better prepare you for combating this very complex disease. The first thing that I want to do is give you a little background about me so you'll understand why I am so interested in this particular subject. I have been an ICU and ER nurse since 2003. And in my clinical experience in the hospital, there were basically two patient populations that we pretty much saw on a regular basis that would always return with various problems. Those were diabetics and patients with congestive heart failure. Now, diabetics have their own diabetes educator that pretty much goes over with them everything that they need to know as far as care and follows up with them regarding their diet and making sure they're doing things as they are supposed to. Congestive heart failure patients, especially in my particular area where I am, we really don't have that kind of resource available. The resource that we have available are for congestive heart failure patients that only have 35% ejection fraction of the heart left. So there's a huge gap there and a huge need for education for those people that have been diagnosed with heart failure, but yet haven't reached to the point that they need extra support with the cardiac rehab program because they have 35% or less function left of the heart. So this particular part of my background came into need recognition when I was in the master's program at Columbus State University. And I started really looking at all of the deficits that we have in terms of helping this particular population. And what I found was that there was a huge need that was not being met in terms of educational needs and provision of needs for supportive care following hospital discharge. So I wanted to really talk at length about that because I have done a video for the healthcare providers on what they need to do to improve care and to really make sure that we give all of the tools for success that you need to be able to stay healthy and stay out of the hospital. The main reason that I really decided to go into this whole thing, in addition to the deficiency in the education for heart failure patients, there's also the fact that my grandmother died from heart failure. And there's not really a lot of talk about what the exact causes are for heart failure. And I want to make sure that I go into that. I also want to have some peace of mind that I have done my part in the education piece to try to make sure that people know what they need to do to stay healthy and to stay out of the hospital. So first we're going to look at the overall causes for heart failure. First of all, there has to be some type of injury to the heart that makes it more difficult for it to do its job, which is to pump blood and nutrients and oxygen all over the body for use by the cells, and to pick up the waste products and take them back so they can be expelled from the body. So what causes this heart failure is fluid. Because of the ineffectiveness of the pump, it can't get rid of all of it like it should be able to. So fluid backs up, and that's what gives that feeling of suffocation. And a lot of people that have it have to sit up to sleep, because when they lay down, they feel like that they're suffocating because of all of the increase in the fluid. What a lot of people don't realize is that sleep apnea is a large cause for heart failure, and is the main reason that a lot of people that are younger get diagnosed with heart failure, because they refuse to wear the equipment to help them breathe. Now they're making changes in the equipment all the time to make it more comfortable and more easy to use. So that is becoming less of an issue as things change. However, a lot of people don't realize that sleep apnea is a tremendous cause for heart failure. Now we're going to look at some particular conditions in addition to sleep apnea that cause heart failure, and exactly how it is that people develop heart failure from these conditions. First of all, high blood pressure causes heart failure. If you think about the muscle strands of your heart being like a rubber band and very flexible, what high blood pressure does is it causes the heart muscle to stiffen and become like bristles on a broom, very stiff, very easy to break, very easily damaged. So this stiffening of the heart muscle is called fibrosis. And it is the main reason for the cause of heart failure, to cause the heart muscle to start to fail. That's why blood pressure control is so important. The second thing that causes heart failure is high cholesterol. It does this because as the cholesterol builds up on the sides of the walls of the vessels, it causes a narrowing. I want you to think about a drain pipe, and how when you pour a bunch of grease down a drain pipe, how it causes the flow to lessen until eventually you get a clog. Well, that's kind of like what we're talking about with cholesterol, because it narrows the vessel walls, preventing the flow, it slows it down, and it increases the workload of the heart to try to get that blood pushed through against that resistance. Now, the main thing that you need to know about smoking is smoking has been found to cause that cholesterol to stick to the vessel walls faster, causing a reduction in blood flow faster, because of the sticking of the fats to the walls and the thinner lumen for it to flow through. Now, street drug use is the other thing that causes people of young age, 20s and up, to develop heart failure. And that is because of the increased workload of the heart and the demand that's required whenever a person uses street drugs. It hurts the heart, and a lot of times these people end up with pacemakers and defibrillators at a very young age. In their late 20s is the earliest I've seen. And usually by then their heart is already the size of a basketball, when it should be the size of your fist. So it's important to realize that lifestyle does have a lot to do with heart failure, and failure to make modifications to the lifestyle is what causes people to have an early demise from this disease, You can prolong your longevity and how long you live as long as you take care of yourself. The other thing that I want to focus on are that diabetes, coronary artery disease, and obesity also add an extra strain on the heart. So these make the heart have to pump harder and work harder. So it is so important that you realize how much of an impact you yourself can make and how well you take care of yourself and your overall health in managing this disease. I want you to realize that there are a lot of procedures that are done in the hospital that are really done to help you have better heart health. Those include having a cardiac cath done, having a bypass surgery done, having a pacemaker placed, having a defibrillator placed. But I want you to realize that the injury to the heart, by having those interventions done, can cause heart failure. It all depends on the level of health of the person is in when they have the procedure. Now, to give you in closing an action plan for improved health, there are several things that you need to do and you need to commit yourself to do to keep yourself out of the hospital to make sure that you stay at your utmost health. Because there is a direct correlation between the number of times that a person goes into the hospital for heart failure and the speed of their decline in their health. The first thing that I want you to do is to have your cardiologist or a nurse practitioner in their office really explain the pathophysiology of heart failure to you, because it is really important for you to understand the why of your treatment plan, for you to really internalize the need of the changes that need to be made. Secondly, family support is important. So if you don't have family support, make sure that you get involved in a support group for heart failure patients, because it really does give you inner strength to know that there are others that are facing the same things that you face every day and that they're experiencing the same battles that you have every day. And thirdly, please make sure that you closely monitor your weight. And if you have a gain of more than 5 pounds in a day, you need to contact your doctor. Now, I know this seems like a real pain in the butt to have to do, but the goal is to try to find out what the problem is that you're retaining fluid before it gets to a crisis point that you feel like you're suffocating and have to return to the hospital. It's better to be proactive and take the bull by the horns and find out what the problem is than it is to delay and find yourself in a crisis and having to go back to the hospital because you can't breathe. I hope that you will take these recommendations to heart. I hope you will share this information with anyone who might need it. If you want to know more about heart failure, I'm going to be doing additional presentations on the actual causes of the two different types of heart failure. There's right-sided heart failure and there's left-sided heart failure. And it's entirely up to you as to how much that you care to learn about your disease. But the more that you learn about it, the more you're going to have a better handle on what you need to do to stay well and stay out of the hospital. Thank you and have a great day.